You've probably been told all your life that fruits are one of the healthiest things you can eat. And while that's true for most people, did you know that some fruits can actually be harmful if you're over 60? That's right. Doctors are warning seniors to watch out for certain fruits that may raise blood sugar, cause digestive problems, or even interfere with medications. In today's video, we'll uncover 6 fruits that may be doing more harm than good, especially if you're a senior. Stick around, because number 6 might just surprise you. Grapefruit can interact with common medications. Grapefruit might seem like a healthy breakfast choice. It's juicy, refreshing, and full of vitamin C. But for seniors, grapefruit can be dangerous, especially if you're taking certain medications. Doctors have long warned that grapefruit can interfere with how drugs are absorbed in the body. This happens because grapefruit affects enzymes in the liver, especially one called CYP3A4. These enzymes help break down many common medications, such as those for blood pressure, cholesterol, anxiety, and even heart rhythm. When you eat grapefruit or drink grapefruit juice, the enzyme gets blocked, and the medicine can build up in your system to dangerous levels. For example, if you're taking statins for cholesterol, like simvastatin or atorvastatin, grapefruit can make the drug stay in your bloodstream longer than it should. This increases the risk of serious side effects like muscle pain or liver damage. The same goes for calcium channel blockers used to treat high blood pressure. These can cause your blood pressure to drop too low when mixed with grapefruit. It doesn't stop there. Certain medications for anxiety, depression, and even some antibiotics can be affected too. The results can range from dizziness and confusion to kidney failure in extreme cases. According to the U.S. Food and Drug Administration, over 85 drugs are known to interact with grapefruit. What makes this even trickier is that the effect of grapefruit can last for hours or even a full day. That means even if you eat it in the morning and take your medication at night, there could still be a problem. Some seniors might think they can just switch to other citrus fruits like oranges or tangerines, but that's not always safe either. Some of these have similar compounds that can also interact, although usually to a lesser degree. A 2020 study published in the journal Expert Opinion on Drug Safety showed that many older adults are unaware of these risks. The researchers found that less than 40% of seniors on affected medications had been warned by their doctor or pharmacist about the dangers of grapefruit. That's why it's so important to read the warning labels on your medication bottles and ask your pharmacist directly if grapefruit is safe for you. It's also wise to look up any new medications you're prescribed. Many lists online are regularly updated with new interactions as more research comes in. If you really love grapefruit and don't want to give it up, talk to your doctor. They may be able to adjust your medication or find an alternative that doesn't have the same risks. But never make that decision on your own. Even small amounts of grapefruit can cause problems depending on the drug and your body's response. It's just not worth the gamble, especially when safer options are available. Instead, consider switching to fruits that don't have these effects, such as apples, bananas, or berries. In short, grapefruit might be good for the average adult, but for seniors on medication, it's a fruit that needs to be handled with caution. It's not just about nutrition, it's about safety. One wrong combination could mean a trip to the emergency room. So the next time you're shopping for fruit, skip the grapefruit unless your doctor has given you the green light. Your health and peace of mind are worth more than a juicy slice of citrus. Bananas can worsen kidney problems in seniors. Bananas are one of the most common fruits in the world. They're soft, easy to digest, and packed with nutrients like potassium, vitamin B6, and fiber. Many people enjoy them as a quick snack or slice them into cereal for breakfast. But for seniors, especially those with kidney issues, bananas can pose a serious risk. That's because bananas are extremely high in potassium, and too much potassium can be dangerous for people whose kidneys don't work well. Healthy kidneys filter extra potassium out of the blood. But when kidneys are damaged or start to slow down, which is common in older adults, they may not be able to remove the extra potassium. This causes potassium levels in the blood to rise, a condition known as hyperkalemia. Hyperkalemia doesn't sound very scary, but it can be deadly. It can lead to irregular heartbeats, muscle weakness, fatigue, numbness, and even heart failure in severe cases. According to the National Kidney Foundation, Even a single banana can contain over 400 milligrams of potassium. That might be fine for a younger adult with healthy kidneys, but for someone with kidney disease or reduced kidney function, that's a lot. In fact, doctors often recommend that people with kidney problems limit or avoid high potassium foods altogether. And bananas aren't the only culprit. Oranges, avocados, and even some dried fruits also carry high amounts of potassium. But bananas are especially tricky because they're so common and are often thought of as harmless. What makes this even more dangerous is that early signs of high potassium are easy to miss. You might feel tired, a little weak, or have a mild flutter in your chest, and many people write that off as normal aging. But behind the scenes, potassium levels could be rising to dangerous levels. A 2022 report in the Journal of Renal Nutrition showed that seniors with even mild kidney dysfunction had a significantly increased risk of complications from eating potassium-rich foods. The study found that many seniors who were admitted to hospitals for heart problems had elevated potassium levels from eating fruits like bananas without knowing the risks. It's also important to note that not all seniors know they have kidney problems. Kidney disease often develops slowly, without major symptoms in the early stages. Many people don't find out until they've already lost a large portion of their kidney function. That's why regular checkups are so important, especially if you have diabetes or high blood pressure, which are the two biggest causes of kidney damage in older adults. Even if you feel fine, your doctor can run simple blood and urine tests to check how well your kidneys are working. If there's any sign of trouble, adjusting your diet might be one of the first changes they suggest. For seniors who do need to watch their potassium, there are still plenty of fruit options available. Apples, grapes, and berries are all lower in potassium and can be enjoyed safely in most cases. You don't need to cut out fruit entirely. You just need to be more mindful of which ones you choose. If bananas have been a daily habit, it might feel like a big change. But with a little planning and some help from your healthcare provider or a dietitian, you can still enjoy sweet, healthy snacks without putting your kidneys or your heart at risk. To stay safe, read food labels and keep track of your daily potassium intake. Some packaged foods may contain hidden sources of potassium too. And if you're ever unsure, don't guess, ask your doctor or dietitian. They can help you create a meal plan that works with your medical needs. Your kidneys may not be able to speak up, but your choices matter more than ever as you age. The key is not to fear bananas, but to understand when and how they can be dangerous. In the right context, they're fine. But for seniors with kidney concerns, it's best to leave them off the plate or enjoy them only with medical guidance. Mangoes can spike blood sugar levels in seniors. Mangoes are often seen as a delicious tropical treat. They're juicy, sweet, and full of flavor. Many people love them in smoothies, fruit salads, or just sliced up on a plate. But for seniors, especially those with diabetes or prediabetes, mangoes can be a hidden danger. That's because mangoes are high in natural sugars, which can cause your blood sugar to spike very quickly. This is especially risky for older adults, whose bodies may not handle sugar as well as they once did. As we age, insulin sensitivity often decreases. This means your body doesn't use insulin as effectively to move sugar out of your blood and into your cells. When this happens, even a single serving of a high-sugar fruit like mango can send your blood sugar soaring. A medium-sized mango contains around 45 grams of sugar. That's more than a can of soda. And unlike fruits with high fiber content that slow down digestion, mangoes are low in fiber, so the sugar hits your bloodstream fast. The glycemic index of a mango is considered medium to high, meaning it can cause quick blood sugar spikes. For seniors trying to manage their blood glucose levels, this can be a serious problem. Consistently high blood sugar can lead to a number of health issues, including vision loss, nerve damage, kidney trouble, and heart disease. These risks are already higher for older adults, so adding mangoes to your diet without caution can make things worse. What's even more troubling is that many people see mango as a healthy choice and assume it's safe. It's natural, it has vitamins, and it tastes good. But just because something is natural doesn't mean it's good for everyone. In fact, studies have shown that seniors with type 2 diabetes who eat high-sugar fruits like mango regularly often have a harder time keeping their blood sugar levels in check. A 2021 study published in Diabetes Research and Clinical Practice found that older adults who frequently consumed tropical fruits had significantly higher fasting glucose levels compared to those who limited these fruits. Mango was listed as one of the main contributors to this rise. This doesn't mean mangoes are toxic or harmful in every case. They do contain important nutrients like vitamin A, vitamin C, and antioxidants. But the sugar content is what makes them risky for certain people, especially in large amounts. If you have diabetes, prediabetes, or even just borderline high blood sugar, it's best to enjoy mangoes in very small portions, if at all. And never eat them alone. If you're going to have a few bites of mango, try pairing it with a food high in protein or fat, like a handful of nuts or slice of cheese. This can help slow down how fast the sugar enters your blood. Also, be careful with mango juice or dried mango. These forms are even more concentrated in sugar and often lack the fiber found in fresh fruit. A small glass of mango juice can have as much sugar as a candy bar, and dried mango can pack over 60 grams of sugar in just a few pieces. These forms of mango are some of the worst offenders when it comes to spiking blood sugar and should be avoided entirely if you're watching your glucose levels. The bottom line is simple. Mangoes are sweet for a reason. They're packed with sugar. And while that might make them taste good, it doesn't make them a safe choice for everyone. If you're a senior managing your blood sugar, it's important to be extra careful with fruits like mango. There are safer options out there that give you vitamins and fiber without the sugar overload. Berries, apples with the skin, or even a few slices of kiwi are better choices. These fruits still satisfy your sweet tooth without putting your health at risk. Don't let the bright color and juicy flavor fool you. For many seniors, mangoes are more trouble than they're worth. Dried fruits can lead to digestive issues and blood sugar spikes. Dried fruits like raisins, apricots, prunes, and dates are often seen as a healthy snack. They're easy to carry, they last a long time, and they seem like a natural choice for seniors who want something sweet without eating candy or cookies. But doctors warn that dried fruits can actually be harmful for older adults. The reason is simple. When fruit is dried, the water is removed, but the sugar remains. This makes dried fruit very high in natural sugar and calories in a small amount. For example, a handful of grapes might contain about 15 grams of sugar. But the same handful of raisins, which are just dried grapes, can have over 40 grams. That's nearly triple the sugar for the same weight. And since dried fruits are small and easy to eat quickly, it's very easy to overdo it without realizing how much sugar you're really eating. For seniors, this high sugar content can cause blood sugar to rise fast. If you have diabetes, prediabetes, or even just poor blood sugar control, dried fruits can push your levels higher than you might expect. Because they have little water and often low fiber compared to fresh fruits, they are digested quickly. That leads to a rapid release of glucose into the blood. In fact, several studies have shown that eating dried fruits can cause a faster and higher blood sugar spike compared to fresh fruit. A 2020 review in the Journal of Nutrition and Aging warned that seniors should treat dried fruits as occasional treats, not everyday snacks, especially if they are trying to control their weight or manage chronic health issues. Another concern with dried fruits is how they affect the digestive system. Some dried fruits, like prunes and apricots, are high in sorbitol, a natural sugar alcohol. While sorbitol can help with constipation in small amounts, it can also cause gas, bloating, and even diarrhea if too much is eaten. Seniors often have slower digestion and more sensitive stomachs, so dried fruits can lead to uncomfortable or even painful symptoms. If you've ever felt gassy or had loose stools after eating dried fruits, sorbitol might be the cause. Also, the high fiber in dried fruits can sometimes be too much for seniors with weak digestion or bowel conditions like diverticulosis. Another hidden problem is preservatives. Many dried fruits sold in stores are treated with sulfites to help preserve their color and prevent spoilage. Sulfites can cause allergic reactions or breathing issues in some people, especially those with asthma. You might not even realize they're there because the packaging doesn't always make it clear. In sensitive individuals, these chemicals can lead to symptoms like wheezing, rashes, or tightness in the chest. That's why it's important to read labels carefully and choose dried fruits that are labeled as unsulfured or no preservatives added if you do want to eat them. Dried fruits are also calorie-dense, which can lead to weight gain over time. A few bites can add up to 200 or 300 calories very fast, without making you feel full. For seniors who are trying to maintain a healthy weight or reduce belly fat, this can be a problem. Unlike fresh fruit, which has water and volume to help fill you up, dried fruits don't offer the same benefit. You might eat a lot of them before realizing it, and by then, you've already consumed a big portion of your daily calories and sugar allowance. To stay safe, doctors recommend treating dried fruit like candy. It's okay to have a few pieces now and then, but it shouldn't be a regular part of your diet. If you enjoy dried fruits, measure out a small amount and eat them slowly. Better yet, replace them with fresh fruits that are naturally lower in sugar and higher in water, like apples, berries, or oranges. These fruits give you the same sweet taste but with more fiber and hydration, which is important for healthy digestion and blood sugar balance. If you're using dried fruits to help with constipation, talk to your doctor about better options. There are safer and more effective ways to improve bowel movements, like drinking more water, getting enough fiber from vegetables, or using doctor-approved supplements. You don't have to rely on dried prunes or figs, which may cause more problems than they solve. In the end, dried fruits might seem small and harmless, but for seniors, they can have a big impact on your health. It's all about balance, portion control, and knowing what works for your body as it changes with age. Pineapple can irritate the stomach and mouth in seniors. Pineapple is one of those fruits that instantly reminds people of summer. It's juicy, sweet, and has a tangy flavor that many find refreshing. It's often added to fruit salads, desserts, and even grilled with meats. But for many seniors, pineapple can cause more harm than good, especially when it comes to the stomach and mouth. That's because pineapple contains an enzyme called bromelain, which breaks down proteins. While this enzyme can help with digestion in small amounts, it can also irritate the lining of your stomach if you eat too much. Seniors who already have sensitive stomachs, acid reflux, or ulcers may find that eating pineapple makes their symptoms worse. It can lead to stomach cramps, burning pain, or an upset stomach that lingers for hours. Another issue with pineapple is its acidity. Pineapple is one of the most acidic fruits, and this high acid content can trigger heartburn and acid reflux, especially in older adults. As we age, the muscles at the top of the stomach can weaken. This makes it easier for acid to travel up into the esophagus, causing that familiar burning feeling in the chest and throat. Eating acidic foods like pineapple can make this problem worse. A 2021 report in the American Journal of Clinical Nutrition found that seniors who regularly consumed acidic fruits like pineapple, citrus, and tomatoes were more likely to report frequent episodes of acid reflux and discomfort after meals. While pineapple may seem light and refreshing, its acid and enzymes can pack a strong punch on your digestive system. Beyond the stomach, pineapple can also cause irritation in the mouth. Many people experience a tingling or burning sensation on their tongue, lips, or the roof of their mouth after eating fresh pineapple. This is once again due to the bromelain, which starts to break down proteins in your mouth. For most people, it's just a mild annoyance. But for seniors who have dental issues, sensitive gums, or healing sores in their mouth, this can be very painful. It can even lead to small cuts or ulcers on the tongue if eaten in large amounts. For older adults wearing dentures, the acidic juice can also irritate the gums and the skin under the dental plate, making it harder to wear comfortably. Pineapple can also cause allergic reactions in some people. These aren't always full allergic responses with hives or swelling, but they can still lead to uncomfortable symptoms like itching, throat tightness, or a runny nose after eating the fruit. People who are sensitive to latex or pollen may be more likely to react to pineapple, due to a condition called cross-reactivity. This means your immune system sees proteins in pineapple as similar to those found in other substances and reacts in a similar way. Even if you've eaten pineapple before without any problems, it's possible to develop a reaction later in life as your body changes. Another hidden concern with pineapple is its sugar content. A single cup of pineapple chunks can contain around 16 grams of sugar, which is on the high side for a fruit. While this natural sugar is better than added sugar, it can still be too much for seniors who are managing diabetes or insulin resistance. The high sugar, combined with the low fiber, means that pineapple can cause a sharp rise in blood sugar if eaten in large amounts or on an empty stomach. Juiced pineapple is even worse, as it removes the fiber completely and concentrates the sugar. If you enjoy pineapple and want to keep it in your diet, moderation is key. Stick to small portions and avoid eating it by itself. Try combining it with protein-rich foods or high-fiber choices that slow down sugar absorption. You can also try cooking the pineapple slightly or choosing canned pineapple in water, which tends to be gentler on the stomach than fresh pineapple. Always rinse canned fruit to remove excess sugars or syrup. If you notice mouth or stomach irritation after eating pineapple, stop and talk to your doctor. There may be better fruit options that won't cause discomfort or health concerns. The takeaway here is simple. While pineapple might look innocent and taste great, it has several hidden effects that can be especially harsh on seniors. Its enzymes, acids, and sugars all work together in ways that can harm the stomach, mouth, and blood sugar levels. It doesn't mean you have to give it up forever, but it does mean you should treat it with caution. A small serving once in a while may be fine for some, but for others, pineapple is a fruit better left out of the bowl. Being aware of how your body reacts and knowing when to stop is key to staying healthy and comfortable as you age. Cherries can thin the blood and cause bleeding risks in seniors. Cherries are small, sweet, and full of color. Many people love them for their juicy taste and enjoy them fresh, in pies, or as juice. They're also packed with antioxidants, which can help reduce inflammation in the body. While that sounds like a good thing, cherries can actually be risky for seniors, especially those who take blood-thinning medications. That's because cherries contain compounds that can affect how your blood clots. These natural chemicals, especially anthocyanins and salicylates, can slow down clotting in a way that may become dangerous when combined with prescription blood thinners like warfarin, aspirin, or clopidogrel. For seniors who are already on these medications for heart disease, stroke prevention, or blood clot issues, eating cherries often can increase the chance of bruising, nosebleeds, or internal bleeding. The problem isn't that cherries are harmful by themselves. It's the combination with medication that creates a concern. When your blood becomes too thin, even small injuries can lead to more serious bleeding. A minor cut may take a long time to stop bleeding. A simple fall could lead to large bruises or bleeding under the skin. In some cases, seniors may experience bleeding in the digestive system without knowing it, which can be very dangerous. A 2019 study in the journal Clinical Nutrition and Aging found that seniors who ate cherries regularly while taking blood thinners were more likely to report unexplained bruising and bleeding symptoms. The study suggested that doctors and dietitians should advise older patients to monitor their cherry intake if they are on anticoagulant therapy. It's not just the fresh fruit that's an issue. Cherry juice and cherry extract supplements are even more concentrated. Many people take tart cherry extract for joint pain or better sleep, thanks to its anti-inflammatory and melatonin content. But this can greatly increase the amount of blood-thinning compounds in the body. Some supplements contain the equivalent of dozens of cherries in just one capsule or spoonful of juice. For seniors taking medications that already thin the blood, this can push the balance too far. It's a good example of how something natural isn't always safe in large amounts, especially when it's used alongside strong medication. Another concern with cherries is their high sugar content. While they're not as sugary as mangoes or dried fruits, cherries do contain a fair amount of natural sugar. A cup of sweet cherries has about 18 grams of sugar. That might not sound like much, but it can add up quickly if you're snacking on them throughout the day. For seniors trying to manage diabetes or pre-diabetes, this can lead to unwanted blood sugar spikes. If you're eating them fresh, stick to small portions and try to eat them as part of a balanced meal instead of on their own. Avoid canned cherries in syrup, as these are even higher in sugar and can do more harm than good. Cherries can also cause digestive problems for some older adults. They contain a type of sugar alcohol called sorbitol, which can cause bloating, gas, or diarrhea in people who are sensitive to it. Seniors often have slower digestion and may already be dealing with stomach or bowel issues, so adding cherries can sometimes make things worse. If you've ever felt gassy or had loose stools after eating cherries, sorbitol could be the reason. It doesn't happen to everyone, but it's something to be aware of, especially if you eat a large portion in one sitting. If you really enjoy cherries and want to keep them in your diet, talk to your doctor first. They may ask you to limit your intake or monitor your blood work more closely if you're on a blood thinner. You might also be asked to avoid cherry supplements entirely, since they can deliver high amounts of the active compounds in a small dose. There are safer ways to get antioxidants without increasing your bleeding risk. Blueberries, for example, have similar health benefits but are less likely to interfere with medications. If you're looking for something sweet and healthy, berries, apples, and pears are often better choices for seniors who need to be careful about blood clotting. The important thing to remember is that cherries, while healthy for many people, aren't the best fit for everyone. Seniors have different needs, especially when it comes to medications and how their bodies handle certain foods. Just because a fruit is natural doesn't mean it's always safe. Being aware of how cherries can thin the blood and raise the risk of bleeding can help you make smarter choices. It's all about balance, moderation, and understanding how your body reacts as you age. When in doubt, ask a medical professional who understands your full health picture. That way, you can enjoy the foods you love while keeping your safety and well-being at the center of every choice.